Hey there, my name is Dr. John Ward and this is my YouTube channel. Want to kind of do a brief description of what this channel is all about. I am a dermatologist and more specifically a Mohs surgeon. Mohs surgeons treat skin cancer using a specific type of surgical technique. So that's going to be a large part of this channel is going to be about what I do. It's going to be information about skin cancer. It's going to be about treating skin cancer. Some of it's going to show surgical procedures that I do, and I will put warnings on the video for people who don't like seeing blood, don't like seeing sutures on those videos. As a dermatologist, from time to time I do extractions of cysts and lipomas and warts and things that people may find interesting, and that will be posted on the channel as well. I do a lot of aesthetic procedures. As a skin cancer surgeon, I have to study about facial anatomy. So do a lot of Botox, a lot of filler injections in which we inject filler into the lips, inject it into the nasolabial folds, into the marionette lines, into the tear troughs. For people with really kind of gaunt faces, we have filler that we inject to fill the cheeks and even into the temples. So I do a lot of aesthetic procedures that people find interesting. Usually aesthetic patients are not going to want their pictures and videos put onto YouTube, so most of the ones that I put on will be people who are staff members here getting procedures done, or patients who agree to have their procedures posted to get discounts on procedures as well. I do a lot of laser procedures to resurface the face to help with fine lines and wrinkles. So not all lasers can be videoed, but there are certain lasers that you can capture on video. As you can imagine, the laser light is very bright and intense, so there will be some laser videos we put on, but there are certain lasers that you just can't get video of. Outside of that, I do hair transplantation and other forms of hair restoration. So we'll be talking about, looking better as you get older, not just in women, but men. A lot of the issues that men have are the same as women. Men are just less likely to talk about it, so, call it Botox in women, we call it Brotox in men. So, we'll be talking about filler in men. And the hair loss is a big thing for men. They don't talk to their friends about it, but they come into the office and they talk to me about it. So not just hair transplantation. We use platelet-rich plasma, which is basically we draw a patient's blood, we spin it into a centrifuge, we take out the blood cells, and what's left is a serum. And in the serum is a lot of growth factors, and it's being used more and more to rejuvenate the skin and to rejuvenate the hair as well. The other things to talk about is just skincare, sunscreen, what you can do to get your skin looking its best. We'll also give away free product from time to time. We have a lot of corporate sponsors that I've already talked about with this YouTube channel about giving away free Botox, free Dysport, free Juvederm, free Restylane, free PRP treatments, free Cool Sculpting. What is Cool Sculpting? So let's say you are hitting the gym hard, you are doing the best you can with your diet, and you still have a few trouble spots. Cool Sculpting was made for you. Cool Sculpting freezes the fat, which causes cell death of the fat cells, which are very sensitive to freezing. But your other cells, your skin cells, your collagen cells, all of that, they survive the process. So after about a month, you start noticing where you had the Cool Sculpting, those pockets of stubborn fat, they go away. I myself have been Cool Sculpted many times. I do spend a lot of time, I'm 41 years old. it's a lot harder than it was when I was 25 to stay looking in shape, being beach body ready, and I don't take aging lightly. I go at it with everything I can. So I do watch my macros. I do make it to the gym 4 to 5 times a week, and I also cool sculpt. So all of the treatments that I'll be talking about are treatments that I've had done myself, or if it's not kind of like a male treatment, it's a female treatment, I can guarantee you I've done it on my wife. If I don't believe in a treatment, I don't offer it. You know, there are a lot of treatments out there that don't provide a lot of efficacy. I let other people do that. I focus on the science, I focus on the treatments I believe in, and those are the treatments we'll talk about. But we will have weekly giveaways of free product. If it's products that are injectables, obviously you'd have to make it into one of our offices. We do have offices in Alabama, Florida, Georgia, and Mississippi. We're one of the largest dermatology practices in the nation, which I founded with my partner. And so from time to time also, because we have an organization of over 250 employees in the healthcare field, if it's interesting to my subscribers, we may talk about managing large companies, employees, how to deal with that, how to deal with today's healthcare environment, how the various laws out there are affecting how we can care for patients. Those are things that if my subscribers want to hear about, we'll talk about it. Last but not least, I did go to the University of Florida, and Gator football is coming up in a few months. And from time to time, we may have some vlogging about Gator athletics. Again, only if my subscribers find it interesting. So it's pretty excited to launch this channel. I think there's a lot of unique information that I have to offer. And if you like what you're hearing, please subscribe. I'm going to try to post new content daily, for sure weekly. And again, very soon we're going to start giving away free sunscreen, free Abaji products, free Botox, free filler. We're going to make a contest. You know, you may have to share a video a certain number of times, or promote the channel and get more subscribers for us. But you'll be glad that you did. Thank you so much, and I'm looking forward to educating and entertaining. Thank you. Bye.